It's my pleasure today to introduce our guest, and for us it's an honor to have Professor Ron Canet from the Samuel Neyman Institute of National Policy Research Tech in Israel. And actually, we are trying in our course to compare a bit the situation among countries and the way different countries had to face the COVID-19 emergency. So we are working with guests from Italy, from Norway, and now, of course, we couldn't miss the chance to interview our colleague Ron Canet, that is located in one of the most interesting states, which is Israel. So I just start with some very common question. So I wanted to know from Ron, which are your impression and your feelings about how Israel government and authorities handled the pandemic, and how efficacy was present in their intervention, and if there were a different way to approach this in the different waves, during the different waves.
So hi Fulvia, hello Clelia. It's a pleasure to participate in this. I was in Milan and I gave a course. I came back to Israel end of January. 2 weeks later, Milan was completely closed as a city, and it looked like science fiction. The Milan I was, and the Milan that was shown on TV were two completely different places. These events escalated, and Israel is a bit of an island. There's a main airport. There's no free movement with Lebanon or Syria, or so. In many aspects, Israel is positioned in a unique situation where there is good control over who comes in and who goes out. So it's different from Italy or other European countries. The first lockdown was by different surveys that were done was probably considered was taken seriously. One of the issues was that the government was not very assertive in terms of the airport. So they did let people come in. They did not want to enter into big fights with the US or with, so they were very lenient on people coming in, and that was probably the main reason why things escalated very fast in Israel. The government lack of assertiveness in setting up effective control systems of people coming in. But the first lockdown was taken seriously. People stayed at home. This is when there was a lot of uncertainty. Where are we headed with this? The news from Italy on catastrophic situations in hospitals, enhanced the sense of urgency, and the initial restriction was 100 meters. Then they expand this to 500 meters, and people in most cases met that. What then turned out is that for political reasons, due to political pressures, some kind of special cases were made. We have a big Orthodox population. We have an Arab population. We have a Jewish population. There's also a Christian population. Each of these populations, these groups, had their internal dynamics. Um, some people started saying this is a non-issue. It's like getting the flu. You should not be concerned. Some people started talking about herd immunity, and the government message got blurred, and then the lockdown was opened up, and this was catastrophic. And then there was a second lockdown. The second lockdown was not considered very serious, and the control was so there was a sense that this was not under control. But then came the vaccinations, and surprisingly, because of the setup in the country, we have 4 healthcare systems, which are pretty strong. They are both the hospital and the general practitioners are in this integrated healthcare systems. This allowed for a very effective vaccination campaign, and in a sense, we were lucky because the vaccination seemed to work, and also there was a realization that the airport needed to be better controlled, and things moved to become much better. So we went through ups and downs. This is not something that was done the best possible way. There were lots of problems, and there's a lot of opportunity to learn from these problems. So I don't know if this was a long answer.
No, very good. And I just place another short question, then I leave the floor to my colleague. So you mentioned herd immunity. So this is a very debated question about whether it exists, not doesn't exist, it will be reached or not, with which percentage. So could you give us your personal feeling as a statistician about herd immunity?
The problem, Clelia, the problem is that this was not treated as a scientific issue. This was treated as a almost religious issue. The discussions on herd immunity were not based on data or evidence. They were based on faith and some, I would say, I call them religious-like principles. So this was not, it's like whether COVID was something serious or was just like a flu. This was also a debate that was very emotional. These debates are very difficult to address from a scientific, with a scientific or statistical perspective. What did turn out is that the prophets of herd immunity, the prophets that were saying, there's nothing in COVID, it's like the flu, their message was at some point strong, and then somehow the media lost interest, and they disappeared. So it was a discussion that stopped, but not because of statistical analysis. This is not because someone came up with data, and there was no real scientific discussion on that. It was a communication wave which was handled almost like a rumor. So it's more into the area of rumor management than statistical analysis.
Okay, so thank you. So it was almost as emotional as it was in Italy communication, as far as I understand. So I just leave the floor to my colleague Fulvia for next question.
Yes, Ron, you mentioned that while Italy possibly helped as a bad example, it's well known that Israel eventually came to be a world example of good practices, especially managing the vaccination campaign. So, what about the communication to the general public? Has been Israel a good example to the world for communicated? People was helped to follow the indication, to follow the rules, to be reassured by how the Israel in Israel was managed the communication.
Yeah.
What are your thoughts? And were there errors too?
So when all this started, the Director General of the Ministry of Health was an economist. He worked before for the Ministry of Finance, and he was in some sense responsible for drying up the healthcare system, not giving budgets to the healthcare system. So he was eventually, so he was a strong economist, and he was the Director General of the Health Ministry, and he was in charge of bringing out the message, that the population needs to comply with the lockdown restrictions, so that the hospitals don't get overwhelmed with patients, and so that we are not facing a big crisis. And he was not effective. People did not consider him a proper spokesperson. Eventually, he was replaced by a physician who was the director of one of the hospitals in the south, and he started talking like a doctor as opposed to a bureaucrat, and this did make a difference. The other thing that happened is that initially the Ministry of Health was in a position that they wanted to control all the information, and the general impression was that they are not telling us everything. They are not sharing the situation properly, and this was aggravated because politicians also played a role in this mess. Then there was a special project person who was appointed by the prime minister, like the Corona Tsar, they called him. He was the chief person. He was also the director of one of the big hospitals in Israel. And the first thing he did is redesign the data system, and then the communication, which was on how many tests there were, how many positive, how many people are in the hospitals. Then this, and there was a dashboard prepared by the Ministry of Health. This became public, and that improved the situation. So the initial position where the Ministry of Health could sort of be a centralized source with not giving access to people to the raw data, that was changed, and that improved that improved. So I think they learned what eventually was proven more effective. They also learned that they need to be completely open. They need to share the information. It's a pity that it took I don't know 8 months for this to happen. This this should not have taken 8 months. I'm not sure about the 8 months, but that's about the time it took for this to happen.
I can understand that the world was surprised, everywhere in the world.
Yes.
We were unprepared, so preparedness is a crucial
Yes, but
lesson.
sharing of data, visibility, these are issues that are issues of principle that should have been, I think, introduced as a matter of principle from the beginning. This is not something that you learn eventually. This is something that should have been a principle of action from the beginning.
In the beginning. Thank you.
But I think it's a lack of, when people don't want to share data, it's a weakness. I think it shows their weakness. So, but there was probably a price paid for that. Part of the issue was that I think the data was a bit confusing. The standardization of the data made it a bit confusing. The way hospitals attributed deaths to COVID was not really standardized. And then came out some also issues like the Orthodox groups, which are close communities, they started providing home care with inhalers that were set up in the home of COVID patients. This data was not available to the Ministry of Health.
Of course.
So when the numbers were reported, it was obvious that there was some massaging of the data, or some data the reporting was problematic, the level of reporting.
Okay, thank you very much. Clelia.
Fulvia, can you hear me?
Yes, I can. Perfectly.
Okay.
Would you go ahead with the next question?
Should I ask for another question? Yes. So my question is, you have seen that there has been a very mixed situation with communication errors and with good communication in different phases of our epidemics. So, which is the role played by statisticians in Israel in improving the communication on numbers?
So this is a key question. This is a key question. The people on TV were either epidemiologists, physicians, or computer scientists or physicists. These were people who also worked for the Ministry of Health and other official agencies. The voice of statisticians was not heard on the front line. There were statisticians involved in the background, but they did not have a place. They did not have a front seat in the media. Why do I say this is a key question? Because there might be two reasons for that. One is, maybe it should have been different. The media should have been more interested, etc. But the other part of the coin is that this might also be self-inflicted, with statisticians not being assertive in wanting to have a role in this communication effort. And I think there is a lesson here for statistics as a profession, which is a lesson that can be learned from COVID. In the UK, David Spiegelhalter played a role. He was quoted in the media. He wrote articles, and we didn't have that in Israel. We did not have that type of visibility in Israel from the statistics profession.
And do you think this is this has been helping or not? The fact that there were not a very popular communicator.
Yeah. So you ask yourself why. Why? One option might be that they don't have something to contribute. That's possible. Maybe they don't have something to contribute. But then it's difficult to see how physicists or computer scientists who only learned about SIR models because of the pandemic got the microphone. They have maybe they are better communicators, but they definitely don't have the perspective that statisticians can provide. So the issue is, I think, also the will of statisticians to become communicators. We had the round table, which means we had a group of statisticians. This was organized by the Israeli Statistical Association, past presidents. We invited 25 people to talk about that, and some statisticians expected people to call them in, but this didn't happen. So some said, why did they not call us? But the fact is that they didn't call you, so maybe you should think of the answer to this question. It's not the fault of the people who didn't call you. It's maybe something that you have not done. Some were irritated that they were involved in some initial data analysis and then they were not used, their models were not used anymore. So whose fault is that? And the point is that in this age of AI, the role of data analysis is not the prerogative of statistics. There is strong competition in the playground of data analysis, and if statisticians will not find their unique selling proposition, they will be second-rate players, not even first-rate players. So I think this situation that we faced has a lot of opportunities for rethinking. Where is statistics in the game? The fact that it was not a major player should raise some alarms for those interested in the profession.
Okay.
The official statistics, for example, the official some people were asking me, we want to compare the death profiles in the first phase of the pandemic to previous death profiles from official statistics. The data that was available was 3 years old.
Mm-hmm.
So what's the value of comparing data to old data? So official statistics also needs to be reviewed, timeliness. The CDC in the US, they were reporting deaths with a delay of 6 months. They reduced it to 1 week. That's only because of COVID. They suddenly, because they wanted to stay in the game, they understood they need to do something to be relevant. If what they report is data of few months before, what policymakers are not going to use this type of information. It's useless for them.
I have
okay, go ahead, Clelia.
I have a very short short question. So you are one of the leading researchers in the world about data quality and information quality. So my question is, how much do you think that these data were really informative, and how do you think we should rephrase the whole context of data to make, in view of the future, data more informative, useful, and to save life with a good data organization?
So that's another very good question. So what we are talking about is data-based decisions. We would like to encourage policymakers to make decisions that have some substantiation driven by data. There is also another situation that is pretty prevalent, which is policy-based data, which means the politicians, they have their priorities, and they are going to focus on data that supports their policies. So they are not interested in understanding what the data says. They are more interested in convincing you that what they decided has some relevance in terms of data. So this means that the citizens also should be educated in understanding if what is fed by politicians to the media is biased, might be fake news, might be incomplete, and the journalists should have the tools to be able to assess that. If we're talking about serious journalism, today there is a big issue if journalism is a show or is about reality, and as people understand journalism as being investigating journalism, or is it just a show? It's like a reality show. You have the Big Brother, you have the news. Maybe it's the same. Maybe it's just a matter of rating. They don't really care about being a deep journalist. They just want people to listen to them because they are provocative. They are giving some information in an attractive way. The way that the information is presented has nothing to do with presenting it in a proper way. And so these questions are also relevant to journalism in general. What type of journalism do you want?
Yeah, you mentioned a lot of emotional around COVID-19. That's another lessons we have to learn from this long crisis. So thank you very much, Ron. I think it's time for us to close this nice conversation. You gave us a lot of insights, a lot about on which to reflect and discuss with our attendees in our short course on communicating health data and the COVID-19 experience. Thank you very much for accepting our
Thank you, and good
Thank
luck. What you do is very important.
Thank you. Thank you.
Thank you, Ron.
So.
Bye.